So, welcome to all you YouTube people out there. My name is Julie Kane, and I'm a nurse practitioner. And I just want to introduce myself here today. I am the owner of Bird Island Wellness. Bird Island Wellness is a medical practice that will be offering virtual health appointments to people who live in Newfoundland. I am licensed as a nurse land. And I also solo practice here in Alaska. So I'm currently living in Alaska, but my dream and passion is to move back to Newfoundland. So I'm here today doing a live YouTube video to hopefully spread the love, spread the word that yes, I want to move back there. I want to have a practice. I want to see patients in Newfoundland. So, with that, a little bit about me. I am like I said, I'm a nurse practitioner. I completely run my practice here. And what I primarily do is my biggest focuses are on weight loss. So I do a lot of medical weight loss. Do a lot of health coaching in terms of helping people achieve their goals. And their goals may be to sleep better, feel better, decrease stress, things like that. So I do a lot of medical weight loss. As well, I do hormone replacement therapy. So, go back a few years. I'm now 40, I will be 49 this year. And several years ago, I myself struggled with very poor sleep. That was the primary thing, was that my sleep was not good. Having a lot of issues with irregular periods and things like that. And I came to find out that it was all related to just the natural aging process and losing hormones. So, what I did was I became educated. I went and did the WorldLink Medical education, 4 parts, and I learned how much hormones affect our bodies and how much they affect aging. So that was quite the eye opener for me because in school, you learn a whole lot about hormones and how they affect your body and how they can be the root cause for a lot of different things. So, um, that is my 2 primary focuses. Like I said, medical weight loss and hormone replacement therapy. Currently, I don't know if there are providers in Newfoundland that practice hormone replacement therapy. So that is one of the primary reasons why I'm so passionate about offering this. Um, Also, today I joined a few groups in Newfoundland and Labrador. One of them is called Newfoundland and Labrador. And I'm not able to comment on this post. I wish I could. But I found this post that was posted an hour ago. And it says, let's talk doctors. I know there is a shortage, it's countrywide. I assume it's no different in Newfoundland. My question is, how do you deal with it? Do you have virtual doctors, walk in clinics, nurse practitioners, or are you just super healthy? So, Miss Laura McNeil Fox, I have a comment in regards to this post. I just received my license as a nurse practitioner last year, last April. It was that actually April 1st, which is April Fool's Day. And I received my license to practice in Newfoundland. I have been trying to get licensed in Newfoundland for several years, and I am from Newfoundland. I graduated from St. Clair's Nursing School. I'm born and raised. So for me, it was a huge struggle to get licensed. So that could be an issue. I over the years of trying to get my license, I have heard from other practitioners that it is difficult to get licensed in Newfoundland. So that's something that I think needs to be addressed. Um, Moving from Newfoundland to the United States was actually very easy to get licensed. It took a matter of like a couple of months. So we need to fix that. The other thing is that there is a lot, I think, and this is just my opinion, that there is some pushback from just I just think it's just a lack of education in terms of like nurse practitioners versus doctors. This is nothing at all bad. This is just my opinion that I think it's Newfoundland has just been a little bit delayed, in my opinion, in terms of allowing nurse practitioners to practice. So that could be an issue. I know here in Alaska that nurse practitioners have been practicing for many, many, many years 20, 30, 40, 50 years. So it's not a new thing. I think we are right about seven or 800 practicing nurse practitioners. So that definitely helps fill the need when it comes to primary care. Um, m- Also, I believe that there is kind of a lack in primary care. I think people are going into more specialties. So, unless we figure out a way to, make primary care um, more of a viable need where people want to practice primary care, I think as a general rule, whether this is in the United States or in Canada, it is an overworked type of, specialty where, you're seeing lots of patients, you're having to manage very complex cases. So, until we figure that out, I'm not sure what the answer is for that. So, that one, in terms of primary care, I just think over time, we're gonna see less and less people practicing primary care. What I like to do myself is I am not I love to find the root cause of, what's affecting my patients. So, in terms of health and wellness, I feel like there are so many things we can do to help turn around the course of our current course, our current trajectory. I think that, for myself, um, I thought I ate well. I thought I was at a healthy weight. I thought I thought I slept well. So that's me. I thought I was doing all the things, but I feel like we can always do better. We can always eat better. We can always exercise more. I think sleep is such a huge factor in terms of health and wellness and just balancing hormones overall. I feel like sleep is kind of the forgotten thing that we should be focusing more on. So, those are just a few things that I just want to put out there so that people, whether you live in Newfoundland or not, I'm looking to reach out to people and help people on their wellness journeys. I think that, you know, we need to do something. We need to fix our food. We need to help decrease the stress in our lives. So that is my focus and that is my passion and I'm trying to reach people to help them on their wellness journey. If you have questions or comments, please add them to this YouTube feed. This is a live feed right now, but I will go back and look at the comments and questions that you have. If there's any sort of topics that you want to see addressed, whether it's hormone related or it's sleep related, supplements, things like that, those are all the things that I do day to day. Um, exercise, things like that while I'm not a personal trainer. There are simple little things that we can do every day to help with that whole, how do I lose fat and gain muscle? So those are all things that I do every single day. Again, please subscribe to my channel. If you haven't already, please share. If you are in Newfoundland, I am trying to reach as many people as I can. This is all free advice, so there is no cost. As well, in the next coming weeks, I hope to have a podcast where I would love for people to listen to my podcast as well, where I'll be diving deep into certain topics and giving much more needed information to patients out there. Hopefully, it'll be things you can use to help you on your journey. So keep a lookout for that. Like, comment, share are all the things that help YouTube channels grow. And again, if you know somebody, just share it either on your Facebook or on YouTube. I appreciate the love and looking forward to visiting Newfoundland real soon.